Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Dirito, a family physician. In this video, we are going to talk about cyber security in the healthcare system. This is one of the ways of protecting patients and systems in the digital era. What is cyber security? Cyber security is the practice of protecting systems, networks, and data from digital attacks. As you are aware, everything now, almost all the health systems are using electronic health records. These systems need to be secured so that you do not have attacks by ill-intentioned people, either hacking the systems or making them stall so that they are paid a ransom. So in healthcare, cyber security safeguards the patient records. It also means safeguarding the medical devices, the ones we use in the healthcare system, and also the communication systems. You realize that many times these systems are sometimes interlinked. So the goal is to ensure that there is good and adequate confidentiality of patient information, there is integrity of the system, and there is availability of the information when it is needed. So what are some of the common ways that cyber attacks happen in the electronic healthcare system? One, there is what we call phishing. This is where deceptive emails are sent to trick staff into revealing important credentials that can lead to access of the electronic health system. Then you have ransomware. This is where malicious software locks the system, and then the people who have locked the system ask for a ransom, and then they can unlock the system. Then we have data breaches, where unauthorized access to the patient or staff information happens. Then we have distributed denial of the service. This is where systems can be overloaded and make them unavailable for the intended healthcare providers. Then we have insider threats, where employees misuse access to the healthcare systems, and they can divulge information that is usually confidential. So why is healthcare a prime target of cyber attacks? One, the healthcare system contains very valuable data, which contains patients' record, which can show financial issues, can also help identify individuals, and also medical information of individuals. Then many times the healthcare system, they do not pay attention to upgrading the electronic health record systems, and so many of these outdated systems are more prone to cyber attacks. Then we also have time-sensitive services. So hackers know that downtimes risk lives, and so they would want to hack, and so they can be paid a ransom. Then the investment in cyber security in the healthcare system is not very good. The budgets are low, and you know the health system is struggling with many things: treatment of patients, commodities, healthcare providers. All these things make thinking about cyber security not a top priority. Unfortunately, this also poses a risk to the healthcare system. Then you have high staff turnover, increases the week of the security systems. So when staff leave, they still have access to some of the data that they are not supposed to when they are leaving. So what are the consequences of cyber attacks? We have compromised patient safety. We have loss of trust and reputation of the electronic health system, legal and regulatory penalties to the healthcare system, financial losses from downtime and ransoms. When you are supposed to pay a ransom to the hackers, then this is loss of money. And of course, when you cannot use the system, you lose services to patients, and you can also lose money, because some of the systems are completely conjoined, and the learning services now manually becomes difficult. So then there is also disrupted healthcare services. Once your system has been hacked, then you have challenges. Remember, this is also a security issue because of the data that is the health care system. So how can we prevent cyber attacks in the healthcare system? One, there is a need for staff training, and this should be consistent so that the staff members realize the importance of keeping secret logins, and also not revealing them to non-suspecting strangers, and also maintaining safe email systems, passwords, and also device practices. Not logging in into the healthcare system using your mobile phones when it is not necessary, because this puts the system at risk. Then there is data encryption, where there is secure data transit, and also when you're not using the data. Then regular updates and patches to keep the software and the system up to date. Then have access control. Use multi-factor authentication and role-based access. So each specific cadre of staff should be allowed to access data that is necessary to their use. For example, people in the pharmacy, they might not really need to know the clinical data of the patient, like what the doctors are able to access. People in the registration, they may not need to have access to the patient's diagnosis. That kind of a system where each cadre has a role-based access. Then regularly backing up the systems so that you don't lose any data, and if there is any challenges, then you have good backup. Then incident response plan. Have a clear plan for handling breaches when any of these laws have been breached. What are the consequences? And the staff should be trained and be aware of this. So best practice for healthcare workers: never click on suspicious links or attachment, so that you keep your system safe. Use strong and unique passwords and sage them regularly. Log off from shared systems when necessary. Report anything suspicious immediately, and don't share access credentials even among yourself, because this could endanger the system, and someone could be malicious and they want to jeopardize the system. So the role of leadership in cybersecurity, it is important that the healthcare leadership is aware of cybersecurity issues, also invest in IT infrastructure, and they also conduct regular audits and risk assessment, and they also enforce cybersecurity policies. So cybersecurity is a critical patient safety and trust issue, and needs to be safeguarded at all times. So everyone in the healthcare system has a role to play, and prevention is cheaper than response, and it is always important to protect our patients and also our system. Thank you for watching, and for more health care tips, please remember to subscribe to the Overall Health channel. Share your comments on what are your thoughts about cyber security, and what are some of the things that you are doing to ensure that if you're in the healthcare system, that your system is safe and not at risk of cyber attacks. Thank you.